recording?
Mm-hmm.
Okay. Bell's palsy is a paralysis of one side of your face due to a pinched nerve that occurs and affects your facial muscles. Imagine waking up one morning and you can't taste anything when you're eating breakfast. And you also, stuff is coming out the side of your mouth. And then you go look in the mirror and you see that half of your face is paralyzed. And it looks like this. This occurs in 40,000 Americans every year, according to the Mayo Clinic. This happened to me on February 18th, 2004, and it lasted for 1 month. I'd like to tell you all about Bell's palsy, a condition that I once had. First, we'll talk about its symptoms. For myself, my eye the day before my face looked like that, was twitching and watering uncontrollably. And then the next morning, I woke up and my face was droopy, as the picture shows, and it affected the left side of my face. Also, my eye wouldn't shut, so I had that trouble going on. Other symptoms include pain in and around the ear, headaches, and tears, excess in tears or saliva, or also a lack of tears or saliva, like I had. Bell's palsy can be caused by many different things. You have two branches of nerves, one that controls the right side of your face and one that controls the left side of your face. And when one of these branches becomes pinched, swollen, it can inhibit your facial muscles and not make them work, as it did in my case. And that is because the nerve becomes compressed. According to Health ANZ, one of the main causes of Bell's palsy is viruses. Some of these viruses include herpes simplex, chickenpox, or mono. According to my mom, my cause is not known. They did multiple tests. I didn't have Lyme's disease, which is one of the causes. They think maybe that it could have been due to when I had my braces adjusted the week prior, but there is no specific cause for me. When you go to the doctor, when you wake up looking like this, the doctors really don't have a specific test to see what has caused Bell's palsy. According to the Mayo Clinic, they basically will just look at the person. They might take an x-ray to see how bad the compression is around the nerve, and they also might do a CAT scan. One can make a full recovery in 3 to 6 months, according to the Mayo Clinic. For myself, according to my mom, I made a full recovery in 3 months. And then my grandma also had Bell's palsy, and hers went away completely with treatment. And then my grandpa's, his didn't go away with treatment at all. He didn't have anything done. And just a little side note, they say that Bell's palsy isn't hereditary, yet me and my grandpa and grandma all had it. So some of the treatments that they might give you for having Bell's palsy are medications. One type of medication they'll prescribe is antivirals, such as acyclovir and cyclovir, because of course Bell's palsy could be caused by the virus, so they'd want to reduce and get rid of that virus. Then there are corticosteroids, which are to reduce the swelling or the pinching of the nerve, and most of you will know these as prednisone. There's also physical therapy that one can do. And I had physical therapy done, and mine was electrotherapy, and that includes where they try to stimulate the nerve to get it working again. And then other types of physical therapy include massage, exercise, and then specific exercises. A last resort is surgery, because that is very, difficult and it can be dangerous, and that would be to decompress the nerve that the pinching and swelling is occurring by. A last type of treatment would be taping the eye. So in my case, my eye wouldn't shut, so it could have ruined the cornea for life and affected my vision. So I had to tape my eye shut every night when I went to bed for a month and put special gel drops in to keep it lubricated. In conclusion, today you have learned about the symptoms, causes, diagnosis, and treatment of Bell's palsy. So the next time if you wake up and your face looks as if mine did, you might have Bell's palsy.